got a very important edition today with Dr. Shane Speights about the Delta variant of the COVID virus that has struck Jonesboro in Northeast Arkansas, as well as a lot of the country. Dr. Speights, please tell us where we stand right now. This is August 11th, and I know times are changing fast, but if you can give us an update of where we stand now, please do.
Absolutely, Bill. Thank you for having me. So I think people, the first thing you need to know is this is a different strain of the COVID-19 virus than we were seeing last year. So don't think that what we saw last year is what we're seeing now, because it's different. And people say, well, how's it different? Well, what's happened is the virus is mutated, which means it's changed genetically. And unfortunately, it's changed genetically to a more contagious virus. It's going to spread much more rapidly. A lot more people are going to get sick with it. A lot more people are going to get infected. How much more infected? Well, when we look at it, the original COVID strain that we had last year that we were dealing with, you had about, let's say, for example, I was sick with COVID. Let's say I had the COVID virus from last year. I would probably infect 2 to 3 people. Now with the Delta variant, this new genetic variation, if I'm sick with the Delta variant, I'm probably going to infect between 5 to 8 people. So it's much more contagious. There's going to be a lot more spread. There's going to be a lot more infections. And we're going to see that. We're already seeing that, obviously, in the state of Arkansas, and certainly here in Craighead County, Northeast Arkansas, and Jonesboro. All you have to do is look at some of the statistics. Just a few months ago, we were only averaging in the state of Arkansas about 180 to 200 cases a day. Really low-level cases, not much at all. We felt like we were on our way out. And then we had this significant uptick in cases. And now here we are at 2,300 cases a day in the state of Arkansas. We're seeing a high number of cases as well in Northeast Arkansas. Typically, you'll see this virus, the high numbers in the more populated areas as it starts to move out into more rural areas.
And I noticed in our daily report yesterday that we are approaching 1,100 cases active in Craighead County, which would essentially top or match or top the record that we saw in last year's highest spike. Can you explain to people who say, well, the people who have had the vaccination are still catching COVID? Can you explain why it's still important to have the vaccination?
Oh, absolutely. And some of this gets complicated, so kind of bear with me for a minute. But when the vaccines were first created for COVID, we found out that they worked really, really well. Like, when you have a vaccine, the big thing is you want to prevent death, you want to prevent disability, you want people to be hospitalized. But these vaccines were so good that it prevented people from actually even getting sick or even knowing they were sick. And that was true with the original COVID strain. Now that we've had these variants come about, specifically the Delta variant, it still offers that same high level of protection, but we do have what we call breakthrough infections, which means that I'm fully vaccinated, but I could still get sick. Now, what's the chance of that? Well, there's still a high chance that I won't get sick at all. The vaccines still protect from that. If I happen to get sick, though, there's a 97% coverage or 97% chance that I won't be hospitalized. And if you don't get hospitalized, you're not in the ICU, you're not on the ventilator, and you're not likely to die from it. So the vaccines still do a significant amount of protection in terms of hospitalization and death. We will see some, again, what we call breakthrough infections. Right now, those seem to be low, but we're seeing more of them. Why are we seeing more of them? Well, it has to go back to really how many people in your community are vaccinated. And unfortunately, in Arkansas and here in Craighead County, vaccination rates are really low. What that means is that even though I'm fully vaccinated, I've got more of a chance to run into somebody who's sick or is unvaccinated and sick and doesn't know it. So every time I run into them, I roll the dice and I may or may not get sick. Well, if I'm in a high vaccination area, let's say 70, 80% people are vaccinated, it's unlikely I'm going to run into somebody that day, or it's a very low chance. If I'm in a low vaccination area like we are now, Craighead County is sitting about 29% fully vaccinated, I have a much higher chance of running into somebody that's sick and unvaccinated and infecting me. So it's kind of a roll of the dice each time you run into somebody. And that's why we're seeing more breakthrough infections in vaccinated people.
Anecdotal evidence is always a dangerous thing, but people tend to believe what they see with their eyes and their own experience more than they do science. And here's my anecdotal story. I know 2 people who have been vaccinated and have caught COVID. One was a very minor case. one actually had to go to the hospital. He said he believed that this would be something that might have been fatal had he not had a vaccination. He sent a very good regimen of what type of drugs they treated him with and made him heal up. But when people don't understand the scientific process, can you help us briefly understand just how science works, how it works? Because when people say, first you tell us don't mask, then you tell us mask, then you tell us we're good, then you tell us we're not good. Please explain that we're not waffling, that science doesn't waffle, science advances, and can you break that down for us?
You know, it would probably take longer than we have here, Bill, but I'll just say this. One of the things this pandemic has done is it's given people a glimpse into the scientific community, into the medical community, and really what we normally do every day. And what I mean by that is we practice and we teach here at the medical school, and we expect physicians to practice what we call evidence-based medicine, which means that we follow the science, we follow the evidence. If this drug shows that it works and it shows time and time again in quality trials, then we can use that drug. And then 5 years later, all of a sudden now studies come out that show that drug doesn't work, then we have to switch. We have to do a 180 and say, okay, new evidence has emerged that we have to change our thinking. Those of us that practice medicine are used to that. The general public, as you said, it almost looks like waffling. Well, it's not waffling. It's that we have more information, we have more evidence, we have more data. We can make a more educated decision. I mean, it's almost like for an individual, you know, who's trying to make their own decision, you know, at home. We could come up with an example of you're building a house or something like that. As you get more information in terms of, well, this is how much you could actually spend on it. This is how much, you know, lumber you have available. This is how much resources you have. You can make a better decision on how you're building that house. Science is very similar. We make better decisions the more data we have. And the data has to be critically evaluated. Just because a study comes out doesn't mean the study is valid. It doesn't mean the study actually was a good study. And so we do something called peer review, which means that somebody else, some third party who doesn't have a vested interest and is not getting paid for it and is not going to get some kickback, they look at the data and say, okay, I've got questions about this, this, and this, because this doesn't look like it adds up. It's hard to do that even during a pandemic, because the pandemic's upon us now. We've got lots of cases, thousands of cases in the state of Arkansas, you know, hundreds of thousands of cases across the country. So how do we make the best decisions? Well, we do the best that we can with the best available data. And I know that's frustrating. You need to know it's frustrating for doctors too. I mean, we get pulled into the same thing. We're trying to make good decisions based on the evidence and the data, and we're trying to piece through it, you know, late at night and weekends and go through and see what we can come up with in terms of the best decisions. That's what we do. But science is complicated. Science is tricky for sure. And the public is just now getting an understanding of what it is that we do normally.
Doug, do hospitals get more money for declaring a patient a COVID patient? That allegation has been pretty rampant for the past year and a half. Is if I say a death had to do with COVID, even though it may have been a heart attack or a whatever else, do hospitals get more money? Are you getting rich?
All right.
Now, let me take that. Do hospitals and doctors get more money for declaring somebody COVID dead?
Let's talk about that. So, and this is something, again, the general public doesn't normally see or have any idea how it works. There's something called a DRG, and there's CPT codes. There's these special codes, basically, that hospitals and physicians use whenever they bill, whether they bill an insurance company or whether they bill Medicare or Medicaid or whatever it is. And those are pretty standard. And so it may be, and it's usually a package. And what I mean by that is, you know, a hospital or a physician would bill, let's say Medicare, for someone who's in the hospital for a viral illness or a viral pneumonia, or they're in the critical care unit, and there's usually multiple diagnoses. They've got kidney failure. They've got, insufficiency of the heart. They've got all kinds of things that these are different diagnoses that may go to that. By and large, the hospitals get one payment for that. It's one lump sum, regardless of what virus it causes it, or regardless of what kind of, bacteria causes it, or that sort of thing. So there's not, to my knowledge, by any means, any kind of incentive for it to be coded as a COVID patient. Now, you brought up an example in terms of, well, it may be COVID versus heart attack. Let me explain that to you for a minute. And I can say this because as a physician, I sign death certificates. I did it a lot, obviously, in the emergency room. I did it a lot when I worked in the hospital. And way before COVID, let me explain how this works. If a patient comes into the emergency room or comes in the hospital and they have influenza, but they also have heart disease, they also have kidney disease, and they also have lung disease. If that individual comes in and the influenza is causing a lot of their symptoms, and they unfortunately die from that, we would put influenza as the chief cause of death. Secondary causes may be the heart disease, the kidney disease, or the lung disease. And the reason why is because, yes, they have heart disease, lung disease, and kidney disease, but prior to getting influenza, they were fine. They were taking their medicines, they were living their life. But it was that they were in a fragile state. When they got influenza, that pretty much tipped over and stressed their body to the point where it couldn't hold on, it couldn't take it. It was too much of an insult to the body. The influenza is what killed them. Now, what put them at maybe a poor health status was the heart disease, the lung disease, and the kidney disease. But the chief cause of death would have been influenza. The same thing is true in COVID. Again, COVID, remember, it's a viral illness. And so you have people, and that's why even vaccinated people that have underlying healthcare issues, and specifically older individuals, they're at a higher risk of hospitalization and death because it's taxing on the system, because it attacks different body organs and different body systems. And so even though you may be fine living with your different disease processes and taking your medications, you're seeing your grandkids, you're walking around the neighborhood, you get COVID, it overwhelms your body. COVID is the cause of death, but you have other underlying secondary illnesses that also contributed to it. I hope that makes sense.
It does make sense. Do you find that other countries have a political division with this? I have friends on the other side of the equator. I have friends in Europe and Mexico, family. Do you find that other places have a political opinion about this?
From what I can tell, I mean, obviously we're pretty divided even in our own country, but I do see, just like everybody else, I watch the national news. I do see there are political divisions. You see leaders denying the fact that it even exists. You see splits in different parliaments. You see the leadership of different countries debating, the use of masks, the use of vaccines, the use of medications. So it's not unique here to the U.S. Certain countries do it better than others, to be honest with you. There are some countries where the population, by and large, there's a lot of trust in the leaders. There's a lot of trust in the elected leaders. There's a lot of trust in the public health leaders. And those elected leaders and public health leaders are all on the same page. And so there's more of a united front and more transparency, so to speak. And so from what I can tell, the people in those countries seem to trust not only what they're hearing, but what's being put out in terms of information to follow or just evidence or recommendations. That's not a lot of countries that I'm seeing, but I am seeing that in a few.
Yes. Well, I just want it to be said that the city of Jonesboro, we trust in Dr. Speights, who's been working on this for you tell me how many months now? At least 18, and not the people that want to shoot a hole in a theory because they think they figured something out. But there's a lot of leaders, not just in America, but around the world, who are trying to get this resolved. And our concern should be, and you complete the sentence, not letting what happen.
So our concern, I mean, we've got, oh gosh, Bill, that's, me, I'm usually not a one-liner, but I would have to say, for us here in Jonesboro, what we need to recognize is the Delta variant is here. It's circulating in our community, and we need to take the steps necessary to protect ourselves and to protect the citizens around us and those that can't be vaccinated. Right now, my big concern is those under the age of 12. There's not an approved vaccine for them. They're about to go back to school next week. I know that the superintendents and the school boards are struggling with different decisions that, may not be popular. I applaud them for making the right choices choices and the right decisions. But, it's going to be hard. I mean, this is really where, when you talk about true leadership and leadership being tested, no time like a crisis is true leadership tested, when you need to step forward and you've got to do the right thing for the right reasons. Nobody said it's easy, but it doesn't make it, doesn't mean it's not the right thing to do. And you and I have had this conversation before, and I'll throw this back out again. Sometimes what's popular is not right, and sometimes what's right is not popular. And I think that the last 18 months for sure, we've kind of lived through that. Those here in Jonesboro, I do encourage masking of vaccinated and unvaccinated individuals, just because we know that even vaccinated people, the new data came out that shows that even they can spread it for the first few days of an infection. Now, it drops off significantly after that, and their risk of spreading it is much lower than somebody who's unvaccinated. But in those first few days, they can spread it. And so that's a concern. So you may feel fine because I'm vaccinated and it's just a little runny nose, and you're spreading it unknowingly to someone who could have a bad outcome from it. Hand hygiene, I can't emphasize that enough in terms of the alcohol-based hand sanitizers, keeping your hands clean. For institutions, organizations that have the ability to do fogging in offices and things like that, I think the fogging is helpful because we know that the virus itself is airborne and can be spread through air particles. I think that's important. Limiting, large group sizes in terms of, significant numbers of individuals meeting together, specifically when you're mixing vaccinated and unvaccinated and, masks or no masks, you're going to probably have infections. And again, I know it sounds like the same thing that I said even last year, but this is even more pertinent information now because the virus has changed. Because this virus is so much more now contagious than the original strain, it's even more important. We're not going to stop the spread of it right now, but what we can do is slow down the spread. We want to mitigate the spread because we want to keep things open. We want to keep things moving forward. We want to keep our kids in school, not on virtual sessions. We know they learn better in person. We want to keep restaurants and all of our businesses moving forward. So the question is, how do we do that safely? And the things I just outlined hopefully can help.
That's perfect. Dr. Speights, you're the Dean of NYIT at Arkansas State University, and you were hired to educate future doctors. And in your spare time now, you are the the pandemic go-to guy. And I don't know when that stops, but we can't thank you enough for your work and your help and your kindness to Jonesboro and Northeast Arkansas.
No, I'm happy to do it, Bill. I appreciate you having me. Yes, I'm very proud of the job that I do, which is the Dean of the medical school. But I am also happy to be able to help out the community and the region and the state in a time like this. To be honest, it would be almost unethical to sit back and watch this happen, knowing what I know and having the resources at my disposal that I have. I mean, all of the brilliant people that we have here at the medical school, the physicians, the PhDs, people that teach and understand and know viruses and immunology and study the SARS virus. It would be negligent not to be able to use that kind of intelligence and that kind of knowledge for the good of our community at this time. So we're happy to do it.
Well, thank you so much. And that goes to everybody at NYIT. I'm sure your students are getting a unique education at this time too.
They are.
Hey, thanks again, Dr. Speights, and we'll be talking to you soon.
Absolutely. Thank you for having me, Bill.
Yes, sir.